Good evening, everyone. I'm Liliya MacKenzie, and I'm an orthodontist on the East Coast of Canada. And I'm so excited to be with you tonight. This is my first Propel Orthodontics webinar. I'm a speaker for Align Technology, and I'm very thrilled that I was invited and very thankful. And I really hope that you will enjoy our time together tonight. So I'd like to send my thanks to my team at Smile Blueprint, Jonathan Maston, who's the Canadian head of Propel, who invited me to be with you tonight. Lori William at Strategics is my consultant, and my very small team at MacKenzie Orthodontics. As a disclosure, I'm not employed by a dental company. I'm a paid speaker for Propel and for Align Technology, and I have evaluated products for them. I own a clear aligner treatment planning and optimization company that is really designed to help dentists and orthodontists increase their treatment efficiency with clear aligners. I own shares in dental companies, and my family members are not employed, nor do they own shares in dental companies. And just as a quick disclaimer, I am compensated for consulting and evaluating products by Propel and Align Technology. For my participation in this event, I'm compensated by Propel. The opinions in this presentation are my own views, and they don't reflect the views and opinions of the company. And these materials are provided for educational use and are not to be used for advertisement or product endorsement purposes. And this presentation has been approved for continuing education credits. No photographs, audio, or video recording are permitted. Okay, so this is my team at home. I have a 13-year-old son who wants to be a math whiz, a 12-year-old son who wants to be a lawyer, but well, actually he really wants to be a Minecraft YouTuber. But as a second choice, he would settle for a lawyer. And then I have a 1-year-old. He wants to own a cow for the milk. And this is my team at work. So I have a practice in southern New Brunswick. New Brunswick is northeast of Maine. And my practice has 3 locations, and all 3 are very, very small offices. In fact, none of them are larger than 1,000 square feet. I have 3 chairs and 2 clinical assistants. So they're both dental assistants, and a team of 2 admin people. And I will show you the schedule that we run out of a 3-chair 1,000 square foot practice. And out of that practice, I'm a Diamond Plus Invisalign provider, which means that on average in a year, I would have about 400 new Invisalign patients. So I just want to show you that it is possible to run a very small and very efficient practice. And if we use the technology properly and we treatment plan properly, we can really increase the practice profitability and the practice efficiency. I graduated from Mount Allison University in New Brunswick. It's a small, what in the States would be referred to as a liberal arts college. I got my Bachelor of Science there, my Master of Science from there. Then I did my dental degree at McGill University and my orthodontic residency at the University of Rochester. I've been practicing as an orthodontist for 12 years. And out of my tiny practice, we run a schedule that is about this full. And it's blurry just because I didn't want to show you the patient names. And I just want to show you that even though the schedule is it looks very full, there's always spots where we can put patients in for a new exam or a start or deliver Invisalign attachments. So we never have to sort of book patients ahead of time and make them wait to start their treatment, make them wait to get their aligners, make them wait to get their consult. We're always able to fit patients in. And the reason for that is just a very, very efficient scheduling and a very efficient practice. So treatment time in my practice is probably the most important determinant for how efficient or for how well the patient does during the treatment. And the reason for that is a short treatment time is associated with a decreased risk of root resorption, a decreased risk of patient burnout, because after a while patients get burned out wearing their clear aligners, they get burnt out wearing elastics, they even get burnt out with their hygiene. It's associated with greater patient satisfaction. There really haven't been too many patients who have complained about being done ahead of schedule. And greatly increased team satisfaction, just because there are no patients who are sort of piling up and using up chair time, and no patients who stay with the practice for a very long time. And I understand if you're a GP, obviously your patients are staying with you, but you really want to have their orthodontic treatment completed in as short a time as possible. And ultimately, that leads to increased profitability. So profitability means decreased number of appointments, decreased chair time, easier appointments. They're easier on your back, they're easier on your staff, they're even easier on your admin team, and ultimately you're using fewer supplies. So I'm going to show you an example of what is not an optimal treatment time, and it is not an optimal practice profitability case. This is a 13-year-old female patient. She presents with a retrognathic mandible, a class 2 division 1 malocclusion with 11 millimeters of overjet, 90% overbite, and some spacing. And so I treated this patient. This was a long time ago, long before I really started using clear aligners for everyone, and definitely long before I started using Propel. And I treated her with crossbow expander combination for 6 months, then full fixed appliances, class 2 elastics, and the result was very nice. The treatment time was 24 months, and it took 17 office visits. And so this is her at her retainer check, and the hygiene has improved. And she and her parents are very happy with the result. But overall, this patient spent a total time in my clinic of 8 hours and 20 minutes. And every appointment was involved. So I actually counted out how long each appointment took and what we did at every appointment. And ultimately, that is how much time the patient and I spent together. In contrast, this is a patient who was finished just recently. It is a very similar malocclusion. I'm not going to read out the diagnosis, but you can see that it's another class 2 deep bite growing patient. And she was treated with clear aligners. She has and high frequency vibrations. So she had clear aligners, elastics, and Propel. And she had 26 aligners altogether with no additional aligners. She was changing her aligners anywhere between 3 and 5 days. And her treatment was done in 16 weeks. That is 4 months, not even 4 months. And she had a total of 4 office visits in my office, and now she's in nighttime retention with clear retainers. And I know that a lot of times I get the question of, okay, this is obviously possible, but how does it retain long term? Not just the alignment of the teeth. We know that the alignment of the teeth is going to get retained if she's wearing her clear retainers, but is the bite going to hold? And I just have to let you know, I did a presentation for Align just recently that where I showed case after case where 3 to 5 years post debond, these patients their occlusions are holding out just fine. In fact, even the ones who stopped wearing their retainers and their alignment has relapsed, their occlusions haven't. So in contrast, so there are 2 patients with very similar malocclusions treated by the same person, 2 very different approaches, one of them a lot more digital than the other, and you can see how the treatment time and the overall practice efficiency is, the treatment time is lower and the practice efficiency is much higher in the second patient. So the total time of the total clinic time that the second patient spent in my clinic was 1 hour and 45 minutes. And actually, I just wanted to ask you if you wanted to write your questions down as your questions, as you get the questions in your head, I would really appreciate that. As you're writing your questions down, I will have time at the end of my presentation in order to answer all of them. And I do promise you that I will go and spend time and answer all of your questions. So feel free to write them down in your question box. So in my practice, the digital workflow without high frequency vibration, so that is the digital workflow of clear aligners. The patient comes in for a consult and we do the scan and all the records at the same appointment. Generally, that appointment is about 40 minutes. And then 4 weeks later, the patient gets the aligners. There's an aligner check afterwards, a rescan, then more aligners, an aligner check, and a debond. And I have an explanation for what happens during every appointment. So during the consult and start scan, I do an exam. We take photos, PANS, Ceph. I run the outcome simulator. I find that that's one of the most important steps for getting the patient really decided to do clear aligner therapy. I write out the prescription or dictate the prescription to my assistant. That's the prescription for the aligners, so that I don't have to go into the Invisalign doctor site and write it out myself. She's going to do it on her admin day. And we do the treatment presentation, the financials. At the deliver aligner appointment, we bond the attachments, we start elastics, and we give home care instructions. Then at the aligner check, which is 15 minutes, we check the fit and the wear of the aligners. We check the elastic wear, any IPR that is necessary. And then at the rescan, I always keep the attachments. So I make sure that the proper attachments are going on day 1 so that I don't have to take the attachments off and put new attachments on. Then we do another prescription, the patient goes back into deliver aligners, and finally at the debond, we remove the attachments and we order the retainer. Sometimes the retainer is pre-ordered, so we deliver the retainer at that time as well. So my initial experience with accelerated treatment was, well, I was hesitant to adopt it because my treatment times are already short. And I didn't want to add extra payments to my patients. I actually was kind of hesitant to start educating patients during the consult about one more thing. I'm already spending a lot of time educating patients about the benefits of clear aligner therapy, and we're talking about hygiene, and we're talking about the number of appointments and the visits. So there's a lot of information. And I was hesitant to overwhelm my patient. And I thought, well, if my treatment times are already really short, why would I incur the extra cost? Well, I'm going to show you a patient. These are all patients treated without Propel. And sometimes the treatments work out beautifully. So this is a 17-year-old female. She is past her growth spurt. She has a severe class 2 division 1 malocclusion with a very deep bite. And basically she refused to have surgery. And so I treated her with clear aligners, and I'm going to show you the I'm going to show you the clean check. I just have to. Perfect. So you will see a video of her clean check, both from the side view and from the front view. And you will see the enormous class 2 correction. And this is done without mandibular advancement. This is just class 2 with elastics, with the understanding that in an adult, this type of malocclusion, we're really making a compromise. This is a skeletal malocclusion that we're treating really dentally. And this is her after 34 aligners. She's changing her aligners once a week. There's no additional aligners. She's done in 8 months in 4 office visits. And this is amazing. And it's proof that if patients are very compliant and the treatment plan is really amazing, you can do some really magical orthodontics in a short period of time. And one other patient, he's a class 2 division. He has a class 2 division 2 malocclusion, sort of like the opposite side of class 2. And he was treated again with weekly changes, no additional aligners in 6 months. And so at this point, why would I want to start using Propel? Well, we want to start using Propel because I also run into patients like this. She's a 23-year-old female with a retrognathic mandible, very similar to the previous patient I showed you. She has a class 2 division 2 malocclusion with 90% overbite and retroclination of the upper and lower incisors. So when we compare her to the previous patient, their starting malocclusions are very similar. He got treated in 6 months. She is similarly compliant. She's actually probably even more motivated. She wears her aligners, she wears her elastics. This is us at 36 aligners. We're not done yet. And this is us finished treatment after 20 months of treatment and 14 office visits. And since then, she has actually come once more to get a retainer adjustment. So there are patients who have the same motivation. They seem to have the same ability to follow instructions and very similar malocclusions, and they have vastly different treatment times. And so the determinants of treatment time are the case complexity, which you can't control. Every patient is going to come and present with their own malocclusion. The patient compliance, and obviously if a patient is not compliant, that's going to extend your treatment time. The treatment plan, which is so important. So I've shown you that if you have a stellar treatment plan, you can have a very efficient treatment. And then the patient physiology. So the age, the periodontal status, the bone density, the rate of bone turnover, and those are all things that you don't know about before you start treatment. And where high frequency vibration really comes into play in my practice is that it really changes the patient compliance and it sort of levels the field for the patient physiology. because it stimulates the rate of bone turnover. And with the patient compliance, we tell our Propel patients that basically the only way that this is going to work is with really amazing compliance. So the advantages, so in my practice, I use Propel for the high frequency vibration. I am very interested to start the micro-osteoperforations, but I haven't done them. So really, when I mention Propel, it's going to be the Propel V Pro. I will give you some of the background behind the micro-osteoperforations, but I personally don't have the I don't have the experience with them, but I have a ton of experience with just using Propel for the vibration. So Propel overall makes difficult movements more predictable. It shortens treatment times, it reduces discomfort and the number of visits. And it's really going to, if you use it consistently, it's really going to differentiate you from your competition, and it's going to differentiate your office as a high-tech office where you're always on the cusp of the changing technology in the orthodontic field. It's going to provide the clinical confidence to quote faster treatment times, and it's going to give you more starts because you will have more availability to see new patients and to see them sooner. So the micro-osteoperforations are associated with a faster tooth movement because of accelerated bone remodeling and increased cytokines. They're very well tolerated. I've actually seen the procedure in a general dental office, and it's probably one of the easiest procedures that I could think of doing in an orthodontic office. It is root protective. There's a transient decrease in bone density and an enhanced aligner accuracy. And one of my favorite things about it is that the micro-osteoperforations are root protective. So if you, in a clinical study, if you place a lot of force on, not a lot, orthodontic force on root, you can start to see microscopic root resorption, so root resorption at the microscopic level with even just an orthodontic force. And if you have micro-osteoperforations in the area for the same amount of force, the root resorption is minimized and there is increased cementum repair. So even some of the microscopic resorption that happens can be repaired. And the Propel V Pro is the first and only high frequency vibration device for active treatment and retention. And whenever we give it to our patients, we tell them, you know, you can purchase one device and several different mouth guards, and you can all share it in your family if you'd like, if there's multiple family members. But it's so important afterwards to hold on to it because you're going to be using during retention as well. And so the way it works is it works both during the osteoclastosis. This is the time when the bone turnover is really high and the roots are moving through the bone. So this is when the bone is being resorbed and there's fast tooth movement, and during the osteoblastosis, which is the building of the bone. And the building of the bone happens both during the active orthodontic treatment, but especially in retention when the roots sort of solidify in their place. They find their new place in the bone, and the bone around them starts to heal and to reform. So high frequency vibration accelerates tooth movement with orthodontic force, and it also accelerates retention without orthodontic force. Basically, it just means that it accelerates the bone formation around the new place of the roots. when there's no orthodontic force on the roots anymore. And there's been lots of research. The physical benefits of, so these are not my slides. The physical benefits of high frequency vibration is the mechanical aligner seating. So it's sort of like, it's very gentle. If you have a rep in your area, please ask them, and you're not using it, please ask them to bring it to your office, because it's really amazing to see. I kind of show them to the patient and I turn it on and you cannot see the vibration at all. You kind of have to hold on to it and realize that that it's vibrating. But that has a mechanical aligner seating effect. And if there's been some orthodontic relapse, so if the teeth are slightly out of alignment and you put the clear retainer on and you use Propel, the teeth will literally go into the retainer, and if you continue that over several days, the retainer is going to seat better, and you're going to get better alignment of the teeth. So the biological benefits of high frequency vibration are decreased bone density during tooth movement, increased bone density in retention, increased bone preservation following extractions, increased PDL fibroblast proliferation, and improved bone quality at retention, and minimized root resorption. So the root resorption is minimized for two reasons. Number one is there's a decreased treatment time, and we all know that increased treatment time is associated with more resorption. So as you decrease the treatment time, just the time while there's orthodontic force on the teeth, you're going to minimize the root resorption. And the second reason is that just that root healing or cementum healing effect that happens. The practice benefits of high frequency vibration are improved aligner accuracy, and we see this all the time. So patients who wear their aligners full time without high frequency vibration for 7 days, and you compare the same patient who has worn their aligner for 5 days, even after 5 days with Propel, the aligner is going to be seated better on the teeth. Definitely a decreased number of refinements because of that better aligner seating, an increased rate of tooth movement, decreased treatment times, decreased discomfort, and improved retainer fit and quality of bone. So the discomfort part, I mean, I've had orthodontic treatment. I've had braces before. The first day I kind of wanted to rip them out. And then I've had aligner treatment afterwards. And the aligner treatment really wasn't that uncomfortable, but for the first couple of days, I really used Advil. And now I tell all my patients, because of my personal experience, I'm kind of going to tell them what I have personally gone through. So I tell them, oh, you're going to have your aligners in the first couple of days, please take some Advil, eat some soft food. Afterwards, there's no food restrictions, but for the first couple of days, just be gentle. And the patients who are getting Propel are now coming back going like, what are you talking about? It was fine. I didn't really feel anything. And those are adult patients. They're not little kids who you would expect to feel some sensitivity. So that was really amazing. And Propel comes with a patient app. The app comes with aligner change reminders, wear tracking, and the patient can actually take progress photos, and there's no doctor involvement that's necessary. So I'm going to show you some case examples of my own patients, and some correction of crowding, class 2s, adults and teens, as well as some more complicated pre-prosthetic treatment. So my first Propel patient, I'm not sort of in love with the result, and I'll explain why, is a 37-year-old male patient with a class 1. He came to me and he basically said, I know you're an orthodontist. I really want to get veneers on my teeth, and because I really don't like the position of my 1-2. And I'm just going to go and I'm going to get veneers on everything, and because I want to get it done as fast as possible, and I'm here and I'm hoping that you can convince me not to get veneers. So we talk about the advantages of orthodontic treatment, and yes, you're going to have to spend some time in orthodontic treatment, but at the same time, it's going to be your own teeth. Long-term maintenance, you just have to wear retainers. You don't have to have the veneers replaced if anything happens to them. And because of that position of that 1-2, you would have to sort of decrease, you would have to do a prep in order to place a veneer on it. So I convinced him that he should get orthodontic treatment, and he wants it done. He actually wants it completed yesterday. And so he got Invisalign and Propel, and this is him after 3 months. And at 3 months, I say, okay, well, this looks very nice. We have good alignment of the upper teeth. We have good alignment of the lower teeth, though I could change the root angulation of the lower incisors for sure, and I could make some improvements of the upper teeth. And he's like, no, I'm done. This is it. 3 months. I'm super happy. I'm going to wear my retainers with Propel, and this is it. And he is delighted. Am I, as an orthodontist, in love with his treatment result? No, but in 3 months, I have a patient who got orthodontic treatment instead of veneers. And for me, that's like a huge win. V-Pro can be used to correct class 2 malocclusion. So this is a 24-year-old male presenting with a retrognathic mandible and a class 2 division 2 malocclusion. A significant overjet and overbite, so the upper incisors are retroclined, and there's increased gingival display of the upper incisors. And he had clear aligners, elastics, and V-Pro. 32 aligners. So all of my adult patients, I instruct them to change their aligners every Wednesday and every Sunday. So technically that's twice a week. You're changing one aligner after 3 days and one aligner after 4 days. However, I do tell them that aligner tracking is more important than the actual number of days that an aligner has stayed in their mouth. So I really teach them what a well-seated aligner looks like. And if they feel that the aligner isn't seated 100%, then I educate them that they should wear that aligner for an extra 1 or 2 days until the aligner is fully seated on their teeth. So really they're changing their aligners based on how the aligners are seating on their teeth, and not so much as how many days are they going to wear their aligner. It ultimately evens out to about every 3 to 5 days. He's wearing full-time class 2 elastics, and this is his treatment results. So I'm just going to go back to the original, and you can see that half a cusp class 2 malocclusion and that gingival display on the upper central incisors. And you can see how the upper central incisors are intruded. The class 2 is fully corrected to class 1, and the deep bite is corrected as well. So this is all done in 4 months and no refinements. I had a patient with a class 3 malocclusion. She was one of my initial V-Pro patients. So this is a complicated malocclusion. It really is a prognathic mandible. It's a skeletal class 3 malocclusion with retrusive maxilla and overjet and overbite together with dental compensation. So proclined upper incisors, retroclined lower incisors, and anterior crossbite. A crossbite on the lateral incisors and on one of the canines. This is a very complicated malocclusion. We talk about surgery. Surgery is completely out of the question. We're going to do basically a dental compensation, and her main concern here, besides the aesthetics of the upper incisors, is sort of the long-term wear, that if she leaves the occlusion in this state, she's going to get long-term wear of her incisors. So this is her after 7 months. She had 32 initial aligners and then 24 additional aligners. She's changing her aligners every 4 days or so. Yes, the upper incisors are proclined, the lower incisors are retroclined. We did some IPR of the lower incisors. I don't ever do posterior IPR, and I would only IPR either for a Bolton discrepancy or in a case like this where I just want to get some positive overjet. And I think that this is really amazing. This was a class 3, basically surgical patient who's now dentally compensated in 7 months. So another adult patient whom I treated had a very narrow maxilla. You can see his smile. He has those dark buccal corridors on both sides. In the photos, you can see the upper and lower posterior teeth are severely inclined toward the palate and toward the tongue. It's 100% overbite and a class 2 malocclusion. And this is him after 5 months of treatment. So the deep bite is fully corrected. You can see his much broader smile, and just notice the change in the maxillary arch from a V-shaped arch to a U-shaped arch. It took 7 office visits, and now he's in nighttime clear retainers and B Pro during retention. And so V-Pro can really be used, and remember, I don't use micro-osteoperforations. It can really be used for patients who have narrow maxilla, and I have found that even in adults, skeletally narrow V-shaped maxilla, you can actually expand a lot with clear aligners without any sort of without periodontally compromising the teeth. So this is a 13-year-old female, and this is probably one of the youngest patients I treated with V-Pro. She has a retrognathic mandible, a class 2 division 1 malocclusion with 100% overbite, crowding, and retroclined upper and lower incisors. The main thing here that I wanted to show you is that high canine. Patients with high canines they're difficult to treat with clear aligners, simply because a lot of times when the patient places the aligner in, when they bite down, there is full seating of the aligner on the edges of the upper incisors and on the posterior teeth, but the aligner does not fully seat. It does not seat 100% on a canine like this. And very frequently in the treatment plan, there isn't enough space that is created around that canine, so you have to do 1 or 2 refinements in order to capture the canine and bring it down fully. sometimes even have to prescribe IPR on either side of the canine. And so she was treated, she had 32 aligners and 12 additional aligners. The treatment time was 6 months, and you can see how the canine came all the way down, the deep bite is corrected, and she's now in class 1. And how narrow can, sort of how much can you expand the arches in an adult? This is an adult patient with a very narrow upper and lower, with very narrow upper and lower arches, severe crowding, especially on the lower. Luckily, the bone around the roots of the teeth is thick. There's the gingival phenotype is very thick. And so we did a lot of expansion. So this is just dental expansion with aligners. There's no expanders or anything like that. And in 7 months, he has a much broader smile. Just notice the difference in the mandible and how much that crowding is corrected. And so he was done in 7 months and 6 office visits. And finally, in an adult, an older adult, she is actually the wife of a dentist, so the wife of a referring dentist, and her chief complaint was that her bite feels overclosed. There is a severe deep bite. She has implants in the 1, 3, and 2, 3 areas, so those teeth cannot be moved. And when she closes, she feels that her comfortable bite is more forward, sort of edge to edge, or maybe sort of 1 millimeter overjet. But because of how her posterior occlusion has collapsed, she's overclosing into a mandibular position that is not as comfortable. And I sort of treated her as if I'm going to treat a patient with TMJ disorder, even though she didn't report TMJ pain per se. She reported tenderness in her muscles of mastication. She reported waking up and feeling very stiff. And she reported sort of feeling comfortable only when she postures the mandible forward. And she was treatment planned by a prosthodontist for a full mouth rehab. And her husband, the dentist, said, see what you can do. We can sort of change the posterior crowns, but she does not want a full mouth rehab because then all the implants will have to be changed, and the crowns on the implants would have to be changed. And she's interested in the least invasive treatment possible. And so this is her after 6 months. So she has had the upper crowns, the crowns of the upper posterior right segment replaced, but not the crowns in the left segment. But so that remains to be done. But you can see that amazing bite opening. So not just the alignment, but how much the bite has opened. Again, it's so important to treatment plan this properly in your ClinCheck or your clear aligner treatment plan. So those bite ramps on the upper incisors and canines are so important. And then the extrusion of the upper and lower premolars is crucial in order to maintain that good posterior bite while opening the bite anteriorly. So now I'm going to go, I'm actually going to finish the case presentation for my patients, and I'm going to go over some sort of tips for practice management tips for efficient treatment. So I showed you the digital workflow without high frequency vibration. So we had the deliver aligners, aligner check, rescan. I almost always would do a rescan, and then deliver new aligners do another check, and then a debond. And so very frequently with high frequency vibration, I find that you can skip that aligner check. You can deliver your aligners. You can book your rescan appointment, and then deliver the new aligners, and then debond. And more often than not, you don't even need that rescan appointment. You can go straight from deliver aligners straight into a debond. So that is how those patients whom I showed you are done in 3 appointments. Basically, their appointments are the consult and start scan is the first one, the deliver aligners is the second one, and then at the 3rd appointment, we're doing a debond, and then they get their retainers. So high frequency vibration streamlines the digital workflow. It reduces the chair time and opens up the schedule for new patients, for new exams. It provides better treatment and fewer visits. And in my office, the way it is billed, so this is all in Canadian dollars. So I charge 500 Canadian dollars for the Propel V Pro, and we have a smile on time promise. The $500 fee is not charged up front. If the patient is on a payment plan, it's included in their payment plan. So basically, it's 2 additional payments or even 3 additional payments at the end of their payment plan. So it's either 2 or 3 payments depending on how much they're paying per month. So they don't feel like they have to pay for it up front. And my smile on time promise is your treatment is going to be 50% shorter, or I will give you the money back for Propel if you're not finished in that treatment time. So my usual estimated treatment time for aligner therapy in someone with a complex malocclusion would be 12 to 18 months, and I would tell my Propel patients that you would be done in 6 to 9 months. And if you're not done in 6 to 9 months, if it extends past the 9-month mark, I will give you the $500 back. However, so we have a contract. I require perfect compliance with aligner wear, and I would know if you're not compliant. Perfect compliance with Propel, and again, you have to use the app, and I would know if you're not compliant, and perfect compliance with hygiene and appointments. And every patient so far who has been presented with the option of regular clear aligner treatment or accelerated clear aligner treatment has chosen to have accelerated clear aligner treatment simply because of that smile on time promise. So that reservation that I used to have about how am I going to present this to my patients so that they buy into it, I can now educate them about how it works, and I don't need to worry about that fee, and they feel like there's almost a guarantee. I tell them that there's no guarantee. This is a medical profession, but I can promise you that you will be done in this amount of time. So I'd like to thank all of you for your attention, and I'm going to start answering your questions. So as I answer questions, please feel free to type more questions in. I will stay here until all of them are answered. So I'm going to read them out. So any long-term studies? I think this question refers to the initial slides that I presented on the correction of class 2 malocclusion in growing patients with clear aligners and class 2 elastics, or clear aligners and mandibular advancement feature. So to answer your question truthfully, there are no long-term studies that I know of. I, in my office, personally developed the technique of clear aligners, bite ramps, class 2 elastics for the correction of a skeletal class 2 malocclusion. I have lots of cases that I can show you. And just recently, because I teach this to my aligned technology study clubs, I teach this technique. I got the question of like, well, this is great that you can do that, but what are the what's the long-term retention of the malocclusion? And I actually, in the last 4 or 5 months, recalled tens of my class 2 patients who had been treated like that and got post-treatment or post-debond photos and cephs. And I can tell you personally in my office, those patients have not relapsed. But it would be great if any of you is connected to a residency program. It would be really great for someone to do a retrospective study. How does high frequency vibration affect periodontally compromised dentition? So with any periodontal patient, you have to make sure that there is no active periodontitis to perform orthodontic treatment. That's the same whether you are using just regular, whether you're doing just regular orthodontic treatment or using high frequency vibration. That is not going to change. Generally, in a periodontally compromised patient, the treatment is faster because the bone support of the roots of the teeth is not as much. So you may want to adjust your times. If the periodontal disease is not active, then you should not be losing any bone. You should not expect to lose any bone. And as far as I know, there have been studies, or there are ongoing studies about actually the positive effects of high frequency vibration with patients, with periodontally compromised patients. I cannot comment on those. I know that they are ongoing, but I can tell you that you should not expect progression of the periodontal disease if you're very careful to select a patient who does not have anything active right now. At what age do you typically treat patients with micro-osteoperforations? I think this would be a great question for someone who is actively using micro-osteoperforations in their practice. I know from studies that it is perfectly safe to use in teen patients, and I have colleagues who use micro-osteoperforations in teen patients, especially for impacted canines or very difficult tooth movements. As I say, I personally haven't used them in my office, but I really hope to start, and maybe next year we're going to have a lecture and I will let you know. I know, so I do a lot of phase 1 I treat a lot of phase 1 patients with clear aligner therapy. In fact, all of my phase 1 patients are treated with Invisalign now, and with them, I get them to change their aligners twice a week. So their bone and their periodontal ligament, the rate of turnover of cells there is so high that it is completely possible to safely move teeth at twice the rate of tooth movement that I would recommend for a teen or an adult. What are some reasons that you would not offer this to a patient? So I don't know. I have patients, so I treat about 95 to 97% of my patients with clear aligners. I don't use Propel on my patients with braces, even though it would work really, really well. So my bracket patients, I have few and far between. They're really for very palatally impacted canines. And I'm just starting to use Propel in them. And so I think that in a future presentation, I'd be happy to present some impacted canines and Propel, but I really don't see a reason why I wouldn't want to offer it to a patient. Again, I would not do it on a young patient, so like a phase 1 patient where we're doing expansion with aligners. Their tissues respond so well to just the force of the aligners. With so few appointments, how do you get the patient education accomplished with respect to emphasizing compliance? We found that it sometimes took multiple appointments to get patients sufficiently educated. So I have to tell you that I live in a very privileged part of the world where when I came here, so I started my practice here 10 years ago. I was the only orthodontist who offered Invisalign to their patients. So there are 3 orthodontic practices in town. There were 3 orthodontic practices in town at the time, and mine was the 4th. And I was the only person offering clear aligners to patients. And within 5 years, because of the demand, all the other practices now are almost 100% clear aligner practices. So I'm not the only Diamond Plus provider in town. There's another one, and also an orthodontist who prints their own aligners. As a result, the patients themselves now, this is like 10 years later, they want aligners. They don't think the braces are cool. They think braces are outdated. My young patients, my 7, 8-year-old patients, don't have friends who have expanders. My teen patients don't have friends who have braces. And so it's a whole sort of population change in mentality, and this is how it works. So I still give my patients the option to have braces, and we go over the sort of information about braces and aligners at the first appointment. And so I give them the advantages and disadvantages. It's much easier to brush and floss when you have aligners because you can take them out and brush and floss. It's much easier to eat. You can have popcorn and corn on the cob and all the things that you can't have when you have braces. It's many fewer appointments. So mom and dad don't have to drive here, and you don't have to spend time in my chair, even though I love seeing you. I think you have better things to do with your life. And the only disadvantage of aligners is if they're in your pocket, they're not going to straighten your teeth. So if you don't wear them, I'm going to put braces on. And my patients, honestly, are amazing. I have not had to put braces. Maybe once a year, I have to say, okay, now we're done with aligners. I'm just going to put braces, finish everything up. I'm not going to charge you for these. Just let's get this done. But overall, the compliance is really high. And I find that with Propel, where they know that if they are very compliant, they're definitely going to be done within a period of time. And if they're going to be getting their money back, they have to be compliant. I have had no issues with it. Okay. Is periapical radiolucency endodontic issue absolute or relative contraindication for orthodontic movement? Or can orthodontic movement continue with periapical pathology? I would not recommend continuing orthodontic treatment with a periapical pathology because you are at a high risk of getting a flare up. And so I would recommend sort of figuring out why you have the pathology, treating the pathology, and then continuing the orthodontic treatment. Now, if the patient is in the middle of orthodontic treatment and they suddenly need to have a root canal because they have acute inflammation of the pulp, then that's a different issue. They can have the root canal. You don't have to wait for it all to heal. You can continue your tooth movement. That is in a more acute situation. But if you have a periapical radiolucency, it's obviously an issue that is chronic and it should be treated first. For your information, we didn't do entire mouth micro-osseous perforations in our office, but doing isolated micro-osseous perforation helped so much with a difficult movement such as a stubborn canine movement or posterior intrusion, extrusion. Totally agree. So this is where I plan to start micro-osseous perforations. Very rotated lateral incisors, areas that are very severely crowded, high canines. Absolutely agree. Micro-osseous perforations don't have to be full mouth. They can be in isolated places and can be very helpful. Have you used it where the tooth is impacted? No, but like a fully impacted canine, I have used it on ectopic canines, but a fully impacted canine, I haven't. I believe that once the canine actually is, once the canine is exposed, that exposure of the canine works instead of micro-osseous perforations. It's a little bit more aggressive than that. So there's a lot of bone healing and bone remodeling in the area. And if we can have high frequency vibration over top of it, I think it's going to be quite good. I'm very, very curious to try. Oh, really nice job with the presentation. I loved it. I love you guys. How much mandibular advancement can predictably occur in treatment excess over jet? So it really depends on the age of the patient. If you have a growing patient, then I've had patients with 16 to 18 millimeter overjets who have been corrected predictably with mandibular advancement. So a mandibular advancement would act like any of your functional appliances. And if you can catch the patient in the growth spurt, I would highly recommend using it. And the way I use it is I start with mandibular advancement, and after a while of holding the patient in that mandibular advancement, I would switch to clear aligners and elastics. Again, works really, really well. And if you're interested in seeing a presentation like that, please talk to your reps, talk to your Propel rep. I'd be happy to show you cases. Talk to your Align Technology rep. Let them know I do this in Canada. I would be happy to do a study club with your group in the US. Perfect. I think we have answered all the questions and we're almost on time. So I so appreciate your patience tonight and your interest and your questions. And I'm looking forward to hopefully seeing you again. And I'm looking forward to hearing from you about how you use these technologies in your office. And I really appreciate some feedback. This is my first Propel presentation, so please, please let your rep know, let the organizers know. I would be more than happy to hear from you. Thank you. Good night.